A leading bioethicist talked to journalists recently about how Americans should prepare for the end of life and about the current controversy over so-called death panels. Dr. Carol Taylor is director of the Center for Clinical Bioethics. This is part of her presentation for the National Press Foundation.
There are basically three goals of medicine, and the first is restoration and cure. I've got a cancer, get rid of it. The second is stabilization of functioning. You've got diabetes, we can't get rid of diabetes, but we can prevent complications and keep you alive and help you to flourish. And the third is preparation for a comfortable, dignified death. The conversation that's not happening is once cure is not an option, do we sit with families and say, two options are available. We can fight this as long as you want. We can do everything we can to optimize your functioning. But it may also be appropriate at this point to transition to preparing for a comfortable, dignified death. Now, this is what President Obama's advisors tried to get into the House bill that Sarah Palin then reported as death panel. Again, this palliative care physician said to me, Carol, I can get reimbursed if I spend an hour with a patient talking about a new type of treatment. He said, if I'm going to sit down and talk with a patient about their goals, what it's reasonable to expect, and whether or not transitioning to purely palliative goals is an appropriate goal, there's no reimbursement for that. So part of what was in that House bill was every 5 years, and a physician could charge Medicare for that, what we call advanced care planning conversation. And what it was touted as, go to factcheck.org, was people are going to be telling you when you're no longer a good candidate for therapies, and then euthanasia will be the option. So there's no question that we need to set limits. But what this is about isn't telling somebody what they should do. It's trying to find out who they are, what their beliefs and values are.